Episode 5, A Gender Clinic Insider Speaks Out.
Right, what's he done? What's wrong?
F***'s sake, the usual. We were sitting across this all yesterday evening, he f***ed off on me, gives a listen to it, tweak this here, tweak that there, move that wee bit, 10 to 9. There's not going to be time to listen to it.
We just need to get this out here. If you got this far in the podcast, you'll know that we're a really tight team in the Nolan show. We can talk pretty freely to each other. Do you know where all these clips are?
Well, I didn't know where they were yesterday, and then he came in, touched the computer, and moved everywhere.
Hello?
Thompson, there's one more change you want to make in this. Now, we have 5 minutes, so tell him not to go ballistic.
Right, hang on, he's here, hang on, you're on speakerphone.
Sorry, you haven't got 5 minutes, you've got 3 minutes.
Yes, but we need a bit of music on at the top of this.
Tommy's one of our senior producers. He's nicknamed Angry Tommy because Nolan really knows how to trigger Tommy.
Get the tension bed. Do you remember the one we used last week? Do you remember?
3 minutes? I know we have 3 minutes. Come on.
It
We
was-
just wasted 20 seconds.
It was great yesterday, and now it's
Thompson, are you with him?
Yes?
Tell him to stay calm. Do you remember the music we used last week?
Yes.
All right, Tommy.
They love each other and they're friends, but...
Okay, right, well, let's do it.
F***'s sake.
The Stephen Nolan Show!
BBC's going to give me a heart attack, so that's the radio show done. Let's get into this bloody podcast. The Tavistock Clinic in London has been at the centre of the row over trans rights. Much of it centres around whether trans children should receive medical interventions like puberty blockers.
I'm delighted at the judgment of the court today. It was a judgment that will protect vulnerable people. I wish it had been made for me before I embarked on the devastating experiment of puberty blockers.
Kira Bell is a young woman who was prescribed puberty blocking drugs at the age of 16. She was part of a landmark High Court ruling that children under 16 could not give informed consent to undergo gender reassignment treatment.
This time last year, I joined this case with no hesitation, knowing what I knew about what had and has been going on at gender identity clinics. My hope was that outside of the noise of the culture wars, the court would shine a light on this harmful experiment on vulnerable children and young people. These drugs seriously harm me in more ways than one, and they have harmed many more, particularly young girls and women. This judgment is not political, it's about the protection of vulnerable children. Please read it carefully. It exposes a complacent and dangerous culture at the heart of the national centre responsible for treating children and young people with gender dysphoria. This fight is not yet over. I would like to personally call on professionals and clinicians to create better mental health services and models to help those dealing with gender dysphoria to reconcile with their sex. And furthermore, I call on society to accept those who do not conform to sex stereotypes, not to push them into a life of drugs and concealment from who they truly are. This means stopping the homophobia, the misogyny, and the bullying of those that are different. Today I'm delighted to see that common sense has prevailed and to see a reinstatement of safeguarding for children.
Dr. David Bell was a consultant psychiatrist at the Tavistock and Portman NHS Foundation Trust in London. The Tavistock specialises in treating children with gender identity issues. He wrote a controversial report on staff whistleblowers, which was critical of the clinic's practices.
A lot of these children were gender non-conforming children. That is, they didn't conform to the rather conventional idea of what a girl is or what a boy is. So just for convenience, if you take the situation of a girl, think of a girl who's non-gender conforming, maybe dresses, behaves and wants to behave in what we think of in our culture as more masculine, may not be interested in sort of girly pursuits, may even have a great distaste for them. And such a girl may also have noticed that she feels an attraction towards other girls. So that is, she's lesbian in terms of what we call her sexual object choice. Don't misunderstand the word choice. It's not as if it is so much a choice, it's what you are. But however, such a girl may pick up, either in herself or in the family or in the world around her, a great hostility, conscious or not so conscious, about the idea of being gay. as a boy once put it to me, my father couldn't stand me with my effeminate gestures, and it caused terrible, terrible trouble in the family. This was someone telling me this as a man, he's not a boy now. Such children, if we go back to the example of the girl, may think, at least for a moment, I'm not a girl, I'm a boy. Now, 20 years ago, or even 10 years ago, many children would have had that thought. And in a sense, it might not have mattered too much. It would have passed. Of course, it matters, but I don't mean it would have had determining consequences. But now, of course, because of the changed culture, there's a tendency for that to be immediately reinforced. So, to put it very briefly, these children internalise a homophobia. That is, they hate themselves for being gay or lesbian. And a way out of that is transition. So in that sense, transition becomes a kind of conversion therapy for gay children.
So I understand everything you've said so far, but what about the what if they're not gay? What about if they are genuinely, at that age, trans? What about if they genuinely know within their core that they are in the wrong body identified by society?
Well, I think that's an inappropriate way of thinking. There's no such thing as a child being born in the wrong body. There's no evidence for that kind of way of thinking about things, and it's certainly very unhelpful.
I don't understand. Surely the whole basis, and I'm approaching this podcast not understanding a lot. I'm trying to learn from it. That's why I'm doing it. Yeah. But surely the whole point of people, when they say they want to transition, they are saying for themselves that they are being identified by society, by everybody else, as something that is not them, that they are in the wrong, they're being identified as the wrong sex. They are a woman. They might have a penis. They might be identified by society as male, but they know they're a woman. They know they're a girl at a young age.
You see, but they don't know that.
Well, how can you tell them what they know?
No. Let me explain. There's a great misunderstanding and confusion between gender dysphoria and being transgender. Gender dysphoria describes a deep disturbance in the child's relationship with their sexual body. For example, and this is common, a girl may hate her sexual body. Absolutely hate it, wants to be out of it. So there's two aspects to this. There's both thinking she is or wanting to be a boy, but also the hatred, which is much more the driving force of the sexual body that you're in. So that's gender dysphoria. Then there are many roots to gender dysphoria, and I was trying to describe some of them before. For example, internalized homophobia is one of them. Other complex problems, for instance, children feeling rather lost in the world and don't know who they are, and because of the influence, particularly peer groups, sometimes families, sometimes social media, they misunderstand this problem as being in the wrong body, and that becomes an explain-all to them. And then there are various other things that I mentioned, such as historic sexual abuse in the family and so on. And this takes us right back to the beginning, you see. So the child may say, I am in the wrong body, I want to change gender. But I understand that as gender dysphoria, and I need time to understand what underlies that. Now, the child's statement that they are in the wrong body and they need to change may change over time. So, for example, there's quite a bit of clinical evidence and studies showing that children who present with gender dysphoria and are intent on going on a medical pathway change their minds if supportively helped in a service that isn't kind of a funneling service towards medical transition, an assessment service for medical transition.
And David, Dr. Bell, is there always a causation? Is there always a reason why a human being will have gender dysphoria, or from birth could someone have it to test for their own body?
I think there's always a reason for it. I don't think there's any evidence that a child is born in the wrong body. A child from very early on may show preferences for gendered activities which are not of their own gender. But that can evolve over time. So, for instance, Stella O'Malley did a very good documentary talking, I think her programme was called It's Time to Talk. But what she was interested in was, for example, in herself, that when she was a teenager, she hated being a girl. She did all boy things, she wanted nothing to do with girls. Now she's, however old she is, I dare say she's in her 40s, and she's married with children and reasonably comfortable in her body. But if she had that kind of feeling now, instead of, 25 years ago or whatever, she would be being referred to the Tavistock Clinic. And there would be an over-acceptance of the idea that she was in the wrong body.
When you say doing all boy things, does such a thing exist, or is that not a creation of society?
No, of course it's a creation of society. Any definition that we have of gender activities is very largely a cultural construction. Not completely cultural, because one's body does affect it, but it's largely a cultural construction. Whereas it seems to me that the trans ideologues treat it in what I would call an essentialist way rather than a constructionist way. That is, that they think there is some real, almost bodily essence that is gender. I don't think that's true. Therefore, they think the only way that it can be changed is by changing your body. But I'd like to finish the other question, because I haven't quite finished, and it's quite important. That is, if you've got a population of children who are all suffering from gender dysphoria, and let's say all those children are 12, let's say that in that group of children, there's Group A and Group B. Now, Group A are the ones who, in a few years' time, they will desist from their belief that they're in the wrong body and won't want medical transition. And I believe there's a lot of evidence to say that is by far the majority group. And then there's another group, who we'll call Group B, who will not desist, but persist. And when they're 18, when they're 19, when they're 20, when they're 21, they're saying the same thing. Now, the thing is, we have absolutely no knowledge, no research, no evidence for any particular child, whether they're in Group A or Group B. So we're at risk of taking the things at the manifest or surface level and acting too quickly on what is being said, and therefore in danger of doing irreversible damage to a child who might have desisted. And that's very, very, important.
But why is that happening?
Well, that's another big question, which of course we don't know. All psychiatric and psychological disorders are outcomes, if you like, of complex interactions between the developing identity, the developing self, and the culture in which you find yourself. No psychological disorder is separated from the culture. And that's very important, because although we may have certain core problems, they're manifested in different ways depending on the culture. So, for instance, in Freud's time, hysteria amongst a certain group was a relatively frequent disorder. 20 years after Freud's death, it disappeared. Another good example would be false memory syndrome. This became a very important diagnosis in the 90s, ideologically driven, that many people were told in a terrible way by therapists that they'd been abused as children when they hadn't, or there was no evidence for that. And that, again, died away. So there's something happening in our culture which we don't necessarily understand, where psychological disorders, psychological problems, core conflicts about the self, about sexuality and identity are being funneled, if you like, through a changing culture into manifesting themselves as gender dysphoria and trans. And why that is probably complex, and I don't think we understand it. And I would say when you get an increase in referrals from 80 to 2,700 over a period of about 8 or 9 years, and that's continuing to increase, you have to ask yourself, you have to pause and say, what's going on? What is happening at the level of the individual, families and the culture that they're in, that this is happening? And the reason that it's happening is because...
Maybe it's just a more accepting culture, Dr. Bell.
Well, that's what that has been said, but I don't think that's the case. The trouble is that there's been an invasion by trans ideological movements who've managed to get the attention of the professions, of politicians and so on, and been able to invade schools in a way which I'm happy to say has now been stopped.
It's a pejorative word where you're describing these organisations as invading.
Yes, I am.
But they're entitled to try to, with the freedom of speech that we treasure in this country, they're entitled to make representations wherever they go, aren't they? They're not.
I don't agree with you. Have you read the children's guidelines as they were before the government changed them?
No.
No. You see, the government changed them in a very, very important way. That is, the schools were being told that the right way to treat children who say I'm of the wrong gender is to immediately affirm it, to celebrate it, and never, never to question. And if you questioned, you were being transphobic. And this has been caused terrible damage because people, even clinicians, become frightened of questioning something for fear of being called transphobic. So the neutrality which is necessary for dealing with these matters is invaded by an ideological movement.
Surely any decent professional clinician will ask those questions and will be neutral. Surely they will. They'll not be frightened of asking the right question, will they?
I'm afraid they are.
Why? Because of lobbying?
Yes. You see, I've got this information from various places, but of course at the Tavistock, I spoke to clinicians who were concerned that some of the children they were seeing had internalised homophobia, and they felt there was a homophobia in the service, unacknowledged. They don't mean a conscious homophobia, but something less conscious. And when they raised this, they were taken off the cases. And they were told they were making a fuss, and they were silenced. And they tried to raise it elsewhere within the trust, and they weren't listened to. And what was in the service at that time was that the way to deal with these things was to affirm them. So if the child says this, rather than taking the clinically neutral attitude, which would be, yes, you say that, and of course I accept you say that, but I need to get to know you, understand where this has come from, what it means to you, and all that. There was a fear in the clinicians that I spoke to that if they tried to do that, they were called transphobic. But to come back to what you're saying, because you put a very important question to me, aren't people free to? The child guidelines have now been changed in a way that Stonewall certainly do not agree with. And that Stonewall trying to still influence schools through their Stonewall Champions movement, where they get schools to sign up. The way those guidelines were changed was, I can't quote you directly, but more or less, it says that it isn't the job of a school to immediately affirm or disaffirm a child if they say they're of the opposite gender. And it warns schools to be wary of gender stereotyping. The guidelines say something which I agree with, which is that we should celebrate gender fluidity. That's fluidity of gender identification. That girls should be free to express themselves in what culturally we think of as more masculine ways, and boys more feminine ways. And that we should help people with if that's the way they want to express.
But doesn't that include calling themselves a boy if they're born a girl?
No. I don't think it's helpful to ever call a child a trans child. I think we should say it's a child with problems who's expressing themselves in a particular way that needs understanding and may become a trans person and may not. But once you call them a trans child, you're doing what we call foreclosure rather than exploring. And of course, the judicial review has supported this perspective. Because one of the things that they mentioned in the judicial review, which is also been mentioned in many places, is that there's been no follow-up of these children. There's no evidential base for this medical treatment. None. The Tavistock service, for example, wasn't even able to give figures to the judicial review of what percentage of children had other problems, such as depression, autism, and the various other things I've mentioned. They weren't able to say what percentage of the children went on to have surgery, because they don't follow them up. I think 98% of children who go on puberty blockers go on to opposite sex hormones, and then a percentage of those will go on to surgery. So by calling the child a trans child, or if they're a girl, saying you are a boy, forecloses when there's a lot more to work with and understand. And, I called my paper recently published, First Do No Harm. And the reason for that is that given that there's no evidential basis, given that there's no follow-up, given that we don't know if the child is Group A or Group B, I think it totally medically not taking care of a child onto a medical pathway which has unknown side effects. We know some of them. We know that puberty blockers affect bone growth. They probably affect brain development. They may well affect cognitive development. All these things are issues that have been raised by experts. So there's a pressure to push through which has to be resisted.
Let me talk to you about the puberty blockers in a moment, but to come back to the question I wanted to ask, which is you said to me that you totally support gender fluidity.
Yeah.
And you define that as, a boy, if they want to do less masculine things in our society, then they should be free to do so. Why should they not be free to identify, if they're able to do all of those activities in our society, why is there any harm in them calling themselves what they want to? If they want to call themselves a girl, why care?
Well, you see, what I was saying, what the new guidelines say is that given that we want to support gender fluidity in children, if children are non-conforming, we must be very wary of treating that as if they're not of their natal sex. Because to do so is to indulge in gender stereotyping. And this is why the LBG Alliance, of course, left the LGBTQ movement, because they felt there wasn't sufficient support for children who may be gay or lesbian and expressing this perhaps as thinking they're of the opposite sex. And it was leading to a kind of conversion treatment for homosexuality, being put on a medical pathway. So I wouldn't necessarily, if a child says they are a boy, if I was looking after that child, I of course wouldn't say you're not a boy if it's a girl. I wouldn't say that. I'd accept what they're saying. And that's okay. But what you mustn't do is subject that child to irreversible medical and surgical treatment whose consequences we don't know. We now know there's a very large growing number of detransitioners, and I've met them, who were absolutely sure when they were children that they were of the opposite sex. The ones that I've met have been largely women, and all of them are lesbian women. All of them are gender non-conforming. But they now realise that they were expressing their difficulties with their sexual body through calling themselves of the other sex. That was supported culturally and socially, and also by the clinic that they attended. And they now feel that that was a terrible mistake. As one young woman put it to us, I look in the mirror, I do not see a male body, I see a mutilated female body. And so that's another important thing, that you cannot change your natal sex. You can change your gender, but you cannot change your natal sex. That's a biological fact.
When we're talking about puberty blocking drugs, 3 High Court judges determined that children under 16 with gender dysphoria are unlikely to be able to give informed consent to undergo that treatment. They actually said it was Dame Victoria Sharp, who was sitting with Lord Justice Lewis, and Mrs. Justice Leaven said it is highly unlikely that a child aged 13 or under would be competent to give consent to the administration of puberty blockers. It's doubtful, they said, that a child aged 14 or 15 could understand and weigh the long-term risks and consequences of the administration of puberty blockers. So help me understand then the politics within the Tavistock Gender Identity Clinic. What was the split in terms of, because all of the people are qualified in some way, what was the split of people who wanted to do it against those people who didn't?
Well, I don't know. You see, I can't give you numbers, but what I can say, because it takes me back to my 2018 report, because my report said exactly what the judges said, that the clinicians that I talked to felt, one, that there was insufficient attention given to the complexities of consent, and two, they didn't think the children really understood what they were consenting to. And they felt that this was a major problem. Now, what the judges said, and it's also what I'd come to learn, is these children, some of the clinicians described them as some of the most difficult and complex children they've seen, and these were experienced clinicians. So the child, it's not as if the child is sitting there saying, I want, or this would be good for me. The children are usually in a much more desperate state. They hate their body. You know, a boy might say, can't talk about my penis. Don't even mention that word in front of me. I want to be rid of it. I can't stand it. I hate this body. I want to be out of it. Now, a child in that state, are they in a state to make a reasoned judgment about the irreversible consequences of the pathway they're about to be put on, which would mean eventually having parts of their body removed, who will be going on opposite sex hormones, which have permanent effects, causing all sorts of effects that can't be changed. If the girl's voice can't be changed back, girls will have to eventually have a hysterectomy because of the dangers of vaginal atrophy. We're learning more and more about the consequences of these irreversible actions. So what I'm saying is, as one clinician said to me, I spoke to the child about the possible or even likely consequences of being anorgasmic. And the child, who was, 12, said, "Ugh, I don't want to talk about that. I don't like sex. I'm not interested in that." Or to another child, "You won't be able to have a baby." "Oh, I'm not interested in babies. That's a woman thing. I hate it." So these children are in quite a difficult, highly conflicted, disturbed state. And the judges decided correctly that they're not in the position to calmly weigh up the pros and cons of the consequences of starting on a medical pathway. Further, even if they were able to weigh it up, which I agree is something they wouldn't be able to do, there isn't the evidence base for them to make any reasoned decision on.
How much does sexual maturity within the body affect someone's vision who up to that point has disliked their body, when they understand the anatomy of the body and the role, a penis and a vagina plays in sex? How important is that in a determinant for whether someone likes their body or not, if they haven't up to that point?
You see, things are on a kind of continuum. I'm trying to struggle with a way of representing this, but I'll tell you what I mean. So it's not uncommon for girls, for example, to manage their bodies reasonably okay until puberty. And it's not uncommon, it's not universal by any means, but it's not uncommon for a girl, once you start to see her breasts grow and the other changes in her body, to hate it, to feel that she's being taken over by something that she can't control. In some situations, which I've been more familiar with, I'm talking about adults, but they've remembered it from their childhood. Say a child had a great conflict with their mother, a girl. So hates her mother, not uncommon, at least to go through a period of hating their mother. But then when she sees herself becoming a woman, gets confused and thinks she's becoming her mother. Fairy stories, of course, full of that kind of narrative. So the girl feels she's becoming her mother, and she doesn't want to show her breasts. She's not proud of them. She's not proud of the other changes. She hates them. Now, that shades into normal development. But amongst those group, there'll be ones who, for various complicated reasons, it's much, much more intense. And given that we're now in a culture in which the possibility of thinking of yourself literally as being in the wrong body, or the gateway is open to a medical treatment, that's likely to accelerate and amplify and increase the number of children who feel like that. That's what I meant at the beginning, that psychology isn't independent of culture. So one of the ways you can also think of it is that when there's a treatment available for something, there's always an increase in the diagnosis of it. Now, you may say that's because people are coming forward for treatment, but some people, and I'm one of them, I think that the very availability of certain forms of treatment leads to an increase in the incidence. I think that was so for hysteria. But what I mean is that there are complex reasons why the numbers go up and the intensity of the demand increases, and that's to do with the culture in which it's set and the availability of services. I don't think there should be a national gender identity service. I think that happened because of the invasion of the trans ideologies into public policy in an unquestioned manner. Why I say that is because these children have multiple problems, and if they get funneled towards a national gender service, all the problems get rebadged as a gender problem. The referral confirms it as a gender problem. And then there's the double problem of acting on it as if it's only a gender problem, possibly subjecting the child to irreversible medical consequences. And also the other problems don't get addressed. I think they should be seen in the context of an ordinary child and adolescent mental health service, a CAMS service, but they would need a lot of extra funding to manage it.
What's your view on Stonewall?
Well, I'm an old 68er. So I was very much part of the world in which gay and lesbian people were coming out, and we celebrated that. And when Stonewall came into being, I can't remember when, but certainly for me it was a great organisation and a great movement, because it was showing us all the ways that gay and lesbian people were continued to be discriminated against. And they've won tremendous battles, not just Stonewall, because society has changed. But if we think of the freedom that gay and lesbian couples have now, which they didn't have before. But for reasons that I don't understand, the interest in gay and lesbian issues seems to have gone away. And they've been they're more or less like a trans organisation. And I don't think this is a matter of freedom. That's a terrible misunderstanding. Because there's a wish, you see, to those of us who are concerned about this in children, there's a tendency to say we're transphobic using the same kind of language of homophobic. Now, I think I've probably said enough to you to make you realise that that's not the case for me. But I think through their capacity, through their Stonewall Champions programme, that people unthinkably sign up to this ideology without realising its implications. That is, its implications for the damage being done to children, and which I'm pleased to say the judicial review have at least partially put an end to. But Stonewall and other organisations were very, very active in promoting the kind of damaging foreclosure that I was talking about, and the damage to ordinary gender fluidity, confusing it with a rather characteristic binary view of gender identity. They also fomented a view which is just wrong. You cannot change biological sex. Biological sex is a material fact. And the women I talked to who'd gone through, surgery, that had mastectomies and so on, they felt very, very let down, being told that they could change their biological sex. They know that they can't. They can change their gender identity. But there's a very strange thing in all this, is that if we accept, at least in an urban culture, we accept much more gender fluidity than there was before. I think that men who are rather effeminate, people aren't really that interested anymore, and people are less interested in who someone goes to bed with. I think culture has changed, and that's a good thing. But it's very odd, isn't it, that that kind of fluidity can go with an acceptance of the biological body. And what's happened is a peculiar, what I would call regression in thinking, whereby the fluidity has become rather caricaturistic and binary, and the body is viewed as if it's fluid, that the body can just be changed. And people talk about this as if it's some kind of cosmetic surgery, like some mild plastic surgery. This is major surgery with potential very serious consequences in terms of surgery going wrong, and I've seen cases of those, tragic cases of those. And it means becoming a lifelong medical patient with all sorts of ongoing possible medical problems that are going to need further treatment. I gave the example of vaginal atrophy. So it's treated superficially, and that's very, very damaging. And the trouble with the gender service is that by when the puberty blockers started, they were regarded as an interregnum, a time to stop and think. And the majority of children came off them and pursued normal development. That completely changed. And it completely changed because of the change in the culture that I've been mentioning. So now it's 98%. So if you put the children on puberty blockers, and the judges said this, you're de facto putting them on a pathway which will lead to opposite sex hormones.
And do you think Stonewall as an organisation, because that's who we are looking at in this podcast, do you think their powerful lobbying is changing the behaviour of a significant number of clinicians?
Definitely. Definitely. Because, you see, clinics are signed up as Stonewall champions. To be Stonewall champions, they have to sign up to the kind of agendas which I've been saying are doing such damage. So you sign up as a Stonewall champion, that implies affirmation towards children with gender dysphoria, affirming them as the opposite gender. That is damaging. They're still trying to influence schools completely against the new government guidelines, to give an affirmative agenda, a kind of immediate celebration of a child who says, and why this is, I don't know, why they've been so captured by this powerful ideological movement. I don't know why that is. I think the person who put this very clearly is James Kirkup from The Spectator, pointing out that in all his 25 years, I think, as a political correspondent, he's never known any movement that so quickly attracted and got the support of professions, government and policymakers, that the only thing that compares, as he put it, with the speed is the complete lack of investigation or understanding.
There's one thing being a Stonewall champion, but are you actually saying that medical professionals trained in fact and discovery are altering how they do things because of a lobby group?
Well, you can't put it quite as directly as that. The lobby group is itself part of a cultural movement and change, but medical history is full of getting things wrong and trying to correct them. You think of lobotomy, for example. Many doctors thought it was the right thing to do. We now know it caused terrible damage and it was the wrong thing to do. Or in our more recent time, false memory syndrome. That was the whole movement that lots of people with psychological disorder in adulthood were really sexually abused in childhood. When there was very little evidence for that, that caused a lot of damage, telling people that they've been sexually abused. So it is one of the curiosities about psychology and psychiatry that we don't function completely separate from the cultural world in which we locate ourselves. And that means, that demands of us that we have to be cautious and scrutinise and be aware of the consequences of big cultural movements that cause a sudden change in the way we think about things. And I don't think there's been that due caution. I think what has happened is that people have thought it's a liberal... I think one of the things that happens, you see, is that I, of course, am totally against any discrimination against transgender people. And I'm aware that they are discriminated against, and I'm aware that they suffer. And I'm, of course, completely against that. But what happens is, the sensitivity we want to completely against that gets confused with having to affirm trans children as trans, and that's very damaging. And I think that's what's happened. People think that this is to do with not discriminating against gay and lesbian, against trans people, whereas I think it's a completely separate matter. And I think the attempt to write it into the same history as homophobia and discrimination against gay and lesbian people is quite willful, and I think it causes considerable confusion.
Stonewall are now so embedded in our society and in many of these organisations, Dr. Bell, that these organisations themselves attempt to climb up a league table created by Stonewall and judged by Stonewall. The BBC is among them, the police is there, the government's there. And so in order to climb up this league table, you need to adhere to Stonewall's policies.
That's right. Where's
the freedom of thought and the independence of those organisations with that?
Well, of course, I agree with you. And that's, I'm not sufficiently knowledgeable, for example, about the police. I have some knowledge of it. But what I have more immediate knowledge of is, of course, my own world, and that's the world of psychoanalysis, psychiatry, psychology, and the Tavistock. And the Tavistock, we've always seen ourselves, as I said, as engaging with a certain degree of complexity, ambiguity, not foreclosing things, not jumping to conclusions, accepting the unconscious or less conscious forces acting on an individual or acting in a family. And yet, the organisation has been captured by trans ideology. And the GIDS service, which exists to some extent in a rather semi-detached relation to the Tavistock, has become huge in the organisation. And that can't be unconnected with the penetration of the ideological movement. But it's true. The Tavistock, to some extent, got captured. I would say that we in the adult department and the Portman Clinic did not. And I suppose I became a central person in that. And that's why there were such attempts to silence me, to remove books from the library, to stop me from speaking anywhere, and to threaten me with disciplinary action.
So you were your books were removed from the library, were they?
No, a book was removed from the library, a very good book, which I wrote the foreword to, called Inventing the Transgender Child and Adolescent. It was removed from the library by the management because it's a very good book. It's not obviously got the same view as current on GIDS, but when you say, we agree with free thinking, it's very characteristic of this debate that people are not allowed their freedom of thought. People are no platformed. And this was a good example of no platforming, that the book was removed from the library on the spurious claim that it raises legal issues. Well, the Tavistock challenged the book before it was published, raising certain legal concerns, and they lost, and the book was published. So they then removed it from the library. Eventually it was put back after I and a lot of people complained. It was put back in the library. But there's been not a single lecture given at the Tavistock that gives the other point of view, say a more psychoanalytic point of view or a more nuanced view about problems of transgender and gender dysphoria in children. There's been very, very little possibility of putting an alternative view within the trust. So the trust has been captured, management has been captured, but there's still protest within the trust, most of it very quiet, but I decided not to be quiet about it.
And have you had any significant levels of backlash because you're not quiet about it? And what type of response do you think you'll get now?
Well, within the trust, as I said, the trust tried to silence me, issued instructions that I wasn't allowed to give lectures or write things about gender, and eventually took disciplinary action against me for my activities. In the end, it didn't happen. But they threatened me with disciplinary action. They set up a disciplinary tribunal, but it was also in the period just before I was retiring from the trust. And there were various complications about that, which I won't go into. But in the end, they decided it had timed out. But I needed legal advice for the last 2 or 3 years in order to continue to be able to speak at meetings, to write things, and be sure that I was, so to speak, safe legally from any action by the trust.
And when you're saying the trust, do you mean the trust that was in charge of Tavistock? Is that what you mean?
The NHS, each organisation is a trust. Every hospital is a trust, or part of a trust, I should say. But the Tavistock is one of the few that's a freestanding trust. So, there might be Camden and Islington Mental Health Trust. That's a big organisation. But the Tavistock is technically the Tavistock and Portman NHS Foundation Trust. So I say the trust. That's what I mean.
And finally, David, we are where we are. What do you think needs to happen going forward, especially in the context of what this investigation is all about, what this podcast is all about? It is how Stonewall, what an incredibly effective lobbying group it is. Whether it's right or wrong, it's incredibly effective. I don't think you can dispute that. No. So what needs to happen now, in your view?
Well, in terms of Tavistock, I find it surprising, and I suppose I should be on being shocked, but I am shocked, that the judicial review could have said what it said. And just to remind you 2 things. One was a focal thing which the judicial review was about capacity consent. But in the course of that review, they raised very, very serious questions about the service. They pointed out to the lack of data, the lack of follow-up, the lack of proper investigation. All that is mentioned. And although the Tavistock are appealing against the judgment, they cannot really appeal against those findings. They can appeal on issues of consent. Secondly, the CQC echoed a lot of those concerns and included in its concerns that clinicians were frightened to speak up. So I find it extraordinary, and I don't know if you know, but on the BBC website currently, there was a 2015 document which the BBC has found, and that document was a review, a consultation to the service, which said it was not managing and it should immediately cap referrals. No action was taken. So I find extraordinary that the NHS England / government can hear all this about a dysfunctional service and allow it to continue. So I think the service should be closed down. I think children with these problems should be looked after by local CAM services. But I'd like to remind you that CAM services have been systematically cut over the whole years of Tory government. And they cannot manage. They cannot manage the fact that they've been cut and the increase in number of children with serious mental health problems. So just to say they could look after this will make things even worse. So there'd have to be proper funding available for CAM service in general, and perhaps a special fund to help with this service. But then the children would be looked after in their local areas in a way that's appropriate. And the other needs that they have, be it autism, we know that up to about 30% of the girls are autistic, or depression or family problems, can all be dealt with in an integrated way. As to the more general problem, that's going to be much slower. And I think that's going to involve trying to show the various stakeholders, which would include, of course, government, how they've been misled. And that is going to take a lot of work. It's possible that
it's going to have a lot of resistance as well.
Yeah, but my sense is that people are beginning to listen. I don't think things were as they were in 2018, whereas, newspapers wouldn't publish anything on this. I think things are changing, and I think people are beginning to see. So I'm guardedly hopeful that the pendulum will swing a bit, and people will begin to see that this has slipped through for purely ideological reasons, not scientific reasons, and has not been interrogated as it needs to be.
This is my final point to you. Are you really saying that the police, the government, institutions like the BBC have been captured?
Yes, of course. And I think it's naive to think any organisation, be it police, the medical profession, government, BBC, is above the influence of the cultural and social networks within which it functions. And it's possible BBC here and the police here, it's symptomatic. They're not outside the culture.
Dr. David Bell, I've really enjoyed talking to you today. and thank you very much for doing so. Thank you.
At Stonewall, we're working towards a world in which all lesbian, gay, bi, trans and queer people can live freely as themselves. LGBTQ+ inclusion makes the world a safer place for everyone, and it is deeply disappointing that in 2021 this can still be thought of as controversial. Our work, from equity in healthcare to advocating for LGBTQ+ people in law, improves the lives of all LGBTQ+ people. And we will continue until every LGBTQ+ person is free to be themselves wherever they are.
Since we talked to David Bell, there's been another development on what's been happening at the Tavistock. This is how it was reported by the BBC's Newsnight programme, who broke the story about safeguarding concerns at GIDS. Emily Maitlis.
A woman who raised concerns about the safety of children at an NHS gender clinic has been awarded £20,000 in unemployment tribunal case. Sonia Appleby is Children's Safeguarding Lead for the Tavistock and Portman NHS Foundation Trust, which runs the Gender Identity Development Service, GIDS. It's the only NHS gender service for children in England. Ms Appleby's job involved protecting children at risk from maltreatment. A number of GIDS staff brought their concerns about the safety of some of the young people being seen to her, including that some were being actively encouraged to be transgender without effective scrutiny of their circumstances. Well, our Newsnight producer Hannah Barnes has been working with health correspondent Deb Cohen. They broke the original news that formed part of Sonia Appleby's case that GIDS staff had reported being advised not to seek help from Miss Appleby. And Hannah joins us now. Just talk us through the ruling, first of all, Hannah. What did that say?
Well, the Central London Employment Tribunal ruled that Mrs Appleby had been vilified for raising concerns, blowing the whistle effectively, about safeguarding issues at the Gender Identity Development Service, known as GIDS. The panel said that she had been treated in a judgmental and punitive way by her line manager at the Trust, and that some senior GIDS staff saw her as having an agenda after she relayed the concerns of GIDS clinicians to others in the Tavistock. The tribunal pointed out that Mrs Appleby had hitherto an unblemished, blameless professional career. It's important to point out that the tribunal explicitly were not making any judgment on the rights and wrongs of the treatments offered by GIDS itself, but rather the rights and wrongs of how Mrs Appleby had been treated.
So what then were the concerns that the GIDS staff took to Sonia Appleby?
Well, the panel heard that Mrs Appleby herself had had concerns about record keeping at GIDS going back to 2016, but those staff concerns included that some children might be gay rather than transgender, but that this wasn't being properly explored, that staff were discouraged from raising safeguarding concerns, that staff who did raise safeguarding concerns were then accused of being transphobic, and that family difficulties and trauma that some of these children had experienced also weren't adequately being taken into account when they were assessed. Now, these are very similar to the concerns that Newsnight broadcast last year, which were contained in transcripts between GIDS staff and the Trust medical director, who is Mrs Appleby's line manager. And those transcripts also contained a claim that staff had been instructed not to seek Mrs Appleby's help. The tribunal heard 2 weeks' worth of evidence. They read nearly 2,000 pages of documents, and they agreed that there had been that explicit instruction to staff because Mrs Appleby was seen as being in some way hostile towards GIDS. The Tavistock Trust say that it is considering the judgment carefully.
The Tavistock and Portman Trust, which runs GIDS, declined requests to be interviewed as part of this podcast. Here's what they said in a statement.
The Tavistock and Portman denies that any steps were taken against David Bell for being an alleged whistleblower. The Trust supports staff raising concerns and has strengthened its mechanisms for doing so in recent years. It is important that all staff can raise concerns without fear of detriment and have them properly addressed. The recent Employment Tribunal decision shows there is always learning in these kind of difficult situations, and we are looking carefully at what this means for us and what we should take from it going forward, including how we best support our staff and protect our patients. We have in the past taken a series of appropriate actions to safeguard our staff. Dr Bell was asked not to speak as a Trust employee on gender identity issues, as his views did not represent those who were providing the service on behalf of the Trust, and the Trust was made aware that several patients and other employees found some of the views expressed by Dr Bell to be offensive.
So, David, since we spoke with Dr Bell, there's been an update in this case, has there?
Yes, since that interview with Dr David Bell was recorded, the Court of Appeal has now overturned the decision of the High Court that under 16s are unlikely to be able to give consent to puberty blocker medication. And the Court of Appeal ruled that doctors can judge if under 16s can give informed consent to puberty blocker use rather than having to go to a court. The appeal was brought by the Tavistock Trust and it was brought over the original High Court case, which itself was brought by Ciara Bell. Ciara says that the clinic should have challenged her more over her transitioning, and she says she was disappointed by this latest decision and she's going to seek permission to appeal to the Supreme Court. In its judgment, the Court of Appeal referenced the landmark 1980s Gillick ruling on the competency of children to make decisions about contraception, and they said that nothing about the nature or implications of treatment with puberty blockers allows for a real distinction to be made between puberty blockers and contraception. In the original ruling, the High Court described puberty blockers as experimental, which is disputed. The Court of Appeal decided that it would have been better for the High Court to avoid controversial factual findings. There was also criticism of the High Court's finding that the vast majority of patients taking puberty blockers go on to cross-sex hormones and are on a pathway to much greater medical interventions. The judgment stated that for the High Court to have reached that position, it would also have to evaluate evidence as to how patients were chosen for puberty blockers, the progression of the treatment, and multiple issues affecting progression between treatment pathways, including the consent processes for subsequent treatment stages. The judgment stated that in practice, the High Court's guidance placed patients, parents, and clinicians in a very difficult position and would have the effect of denying treatment in many circumstances for want of resources to make such an application, coupled with the inevitable delay through court involvement. The Court of Appeal judgment also cleared up a misconception that it's the Tavistock that provides puberty blockers to children. The Tavistock refer children onto other NHS trusts, and it's those trust clinicians who consider the prescription of puberty blockers.
Coming up in the next episode, we find out what influence Stonewall has had on public policy across the UK and find out how the word mother has been removed from some government documents.